We'll talk now about the female reproductive anatomy, and I'll go over some other anatomy that we haven't touched on, specifically the pelvic viscera. So real quickly, bladder. In most patients, it's going to pop right out at you. This is a pretty good sized bladder filled with some urine, and here's the rectum posterior to that. Okay, so whether it's male or female, you're going to have bladder anterior and rectum posterior. Okay, the only difference is there's some other stuff mixed in here, whether it's a male or female patient. Okay, and we talked about that in lecture. So let's start at the bottom for this one because I think it's a little bit easier. We'll start down here. We have our symphysis pubis is right here. Okay, so just posterior, we're going to have the bladder. Okay, so here's bladder. And we'll follow that up. And then in a female patient, most inferior, that is posterior to the bladder, but anterior to the rectum, is going to be this collapsed bundle of muscle fibers, which is the vagina. So this is right here. So now if we follow this up, you can see how it kind of is starting to head anterior. This is now, we're in uterus here. Okay, so at the point where here's cervix, where it's starting to kind of change the color. It's a bundle of muscle fibers that's collapsed on itself as the vagina, but once it comes into the uterus, there's an actual cavity there that isn't necessarily always collapsed, and it's a thickened area. So here's cervix. So we're now entering into the uterus. And then remember, the uterus should be, in most females, although not all, anteverted. So it's going to be pear-shaped and it should point towards the front. This is the front. Okay, so we should see it take a turn, and here it goes. Here's the uterine cavity taking a turn towards the front. And now remember, we're now also traveling superior, so we're also going up. So we're now into the fundus of the uterus. So here's the fundus of the uterus right here. Okay, here is your left ovary, and here is your right ovary over here, which is also having this huge cyst that's associated with it. Okay, so uterus right here, traveling down, cervix, this kind of changed area here, traveling down, vagina, sandwiched between bladder and rectum, all the way down, and then just prior to exiting the body, anterior to the vagina is going to be the urethra. So here's the urethra right here. Okay, and you can follow that down. Rectum, and eventually you'll come down to anus, but we're not quite inferior enough. Okay, so this is the axial view of female anatomy. Uterus is usually the easiest to see. It's going to be superior to the bladder. It should be anteverted, although it's not always going to be. Fundus here. We have one ovary over here that's normal, and then we have this ovary over here that's not so much. Uterus, here's your bladder, vagina, traveling down, urethra, rectum, symphysis pubis right here. Okay, let's switch over to coronal, and let's look at this in a coronal view. Oh wait, one other thing that I want to, we can do it in the, let's not do coronal, let's do sagittal. So here's the sagittal view of the same stuff that we just talked about. So we'll go to one side or the other. We can start right in the center. I think maybe for this one, starting right in the center is going to be the easiest because this looks almost exactly like some pictures in your textbook. So here's your uterus, anteverted, okay, the fundus. You can see the uterine cavity in here, okay, this little opening here. It's going to curve around. This area here is your cervix, right in this area, the two separate openings, and then into the uterus. Here's vagina, sandwiched between the bladder and the rectum. Okay, this is pubis, symphysis pubis here. So then now we have to talk about the different spaces. We have retropubic space, is the space just posterior to the pubis. We're going to have a space between the bladder and the uterus, this kind of space in here. Okay, that's your vesico, meaning bladder, uterine pouch right here. And then the space between the uterus and the rectum, space right in here, your recto-uterine pouch. Okay, so those are your spaces. And remember, we're looking for them, especially for you sonographers, because we're going to look for fluid collections in these areas. And that's going to be a determination of a potential pathology going on. And I'm guessing that this, I'm not an MRI tech, but this, there's nothing in the vesico-uterine space, but it looks like there's some fluid in the recto-uterine space, and it's probably because of this huge cyst here. Okay, so there you go. That's female anatomy. Those are the anatomical parts you should be able to visualize and point out on a test.